Solving Problems Through Interventions, Nursing 848, the Pennsylvania State University College of Nursing. My name is Brenda Squires, and my intervention for my capstone project is development of a new cross-functional associate program. Surgical site infections, or SSIs, cause increased pain, higher overall costs, readmission, and longer lengths of stay, and those patients have an increased mortality. 60% of those SSIs recorded are preventable. One contributing factor in the cause of SSIs is a break in sterile technique caused by a failure to follow proper environmental cleaning protocols. Following concerns brought by OR staff and physicians, we began an investigation into the cleanliness of our operating rooms using an adenosine triphosphate bioluminescence device. What we found was we were not following proper environmental cleaning protocols, and we were failing our patients. Cross-functional associates, or CFAs as we call them, are responsible for cleaning the ORs between cases and for a terminal cleaning at the end of the day, among other responsibilities in the department. Through an investigation, we found a lack of proper cleaning methods, which is getting passed on to new employees in orientation. The current CFAs felt they needed re-educated on the proper cleaning protocol for the tools and detergents they currently use. In addition, the orientation process is unstructured, leading new employees to feel unprepared for the responsibilities required of them once they become independent. While interviewing OR nurses and techs, as well as the CFAs themselves, there was a perceived lack of accountability for work performed or not performed. 20 to 25% of all hospital infections are caused by improper disinfection and sterilization of equipment. Our facility uses CleanTrace, a product that performs the adenosine triphosphate bioluminescence test. This test looks for residual proteins left on the equipment and operating room furniture, and these proteins signify a bioburden remaining after the cleaning process. The initial results were not great, but we have seen an improvement in the short time since initiating this project. While these tables are a little bit small and maybe a little difficult to read, you can still see the color bars pretty well. These color bars signify the CleanTrace test results. Green is pass, red is fail. The picture on the left shows the initial tests completed from January through February. The picture on the right shows test results completed between March and April. As you can see, while we still have plenty of room for improvement, there has been a 23% increase in the pass rate, and we can see more green than red in the short period of time since implementation of this project and re-education of the staff. Through interviews with the current but newer CFAs, it was determined that the current orientation process is frustrating for them. It lacks structure, and more often than not, it missed important education opportunities for equipment and basic OR workflows. Orientation is seen as one of the most influential pieces of development in new staff. It should focus not only on the what and how of the job, but also the why. A new, standardized, structured orientation process was developed. This new process includes the education components they felt were lacking initially. The new process was completed and implemented just in time for 2 new CFAs to start their work there. An overall assessment of the new program will be performed once they complete the orientation in a couple more weeks. Another piece many felt was lacking with the CFAs was accountability for their work. Some of the concerns raised were with the regular cleaning of the ORs, the end-of-day terminal cleaning, and subsequent room setup for the next day's cases. OR equipment did not have a designated home and was not getting returned to the same place consistently. This made it difficult and timely to find this equipment when they needed it. There was also a lack of general knowledge and understanding of their job responsibilities depending on daily assignment. Addressing all of these concerns was no easy task. First, the equipment tech was tasked with creating a binder which includes pictures, locations, and basic functions of every piece of equipment in the OR. This will be kept in a central location for all staff to review as needed. The rep for our cleaning products and tools was brought in to re-educate the staff on the cleaning protocols specific to these products. This will now become an annual competency for the staff. This will help keep the information fresh and ensure proper techniques. A full review and revision of job responsibilities was done for every assignment and updated with current information. All current CFAs were provided a copy of these assignments to review, after which they signed an attestation stating they received the information, they understand it, and they're now responsible for their assigned duties. Finally, a check-off peer review sheet was designed and implemented in every room. The CFA who performed the terminal clean for that room initials all tasks as complete, and the nurse or tech assigned to the room next reviews the work completed and signs off on it. Most importantly, this piece offers the nurse the information of who to follow up with if something was not done properly, or to tell the CFA great job if they did perform well. This review process helps ensure the quality of the work and therefore the safety of the patient. One of the largest barriers I found was the perceptions of the CFAs. They had perceptions about this project. Many of them, especially the more experienced ones, felt they were being picked on and they were getting beat up. I sat with some of them on multiple occasions, just listening to their concerns and offering support. I accomplished more by helping them understand that I was trying to help them so that they could work better together more than I was trying to fix them. A second barrier to the project was with the orientation restructuring. Trying to fit all of the education and teaching components into the orientation timeline and accomplish everything within a reasonable amount of time for an entry-level position proved to be quite the challenge. A 4-week timeline was finally decided upon, with an available option for a 5th week if it became necessary. Next, when reviewing assignment responsibility lists, 3 versions were found for each of the 9 assignments, all of which were outdated. Utilizing experience, some research, discussion with the staff, and judgment, an updated version of each assignment was completed. Working with the CFAs to accomplish this task allowed for a level of trust, which helped break down the perception barrier previously discussed. Many of the quality improvements made here relied on a level of participation from the OR nurses and techs as well. Some of these were the surveys and the checklist peer review forms. With an initial lack of participation from the OR staff, collaboration with their leader and charge nurse was necessary to complete the project tasks. To evaluate the outcomes of the changes and improvements related to the project, several studies were performed. One such study is the CleanTrace results from prior to re-education and then again following the re-education. These results were shown earlier. On this slide, you can see a different result showing how we hold the CFAs accountable for their cleaning by having them re-clean a room that did not pass. After they re-clean, we retest. As you can see, all retests show a 100% pass rate. Next, in order to evaluate any perceived improvements from the nurses and techs in the OR following the implementation of the checklist peer review form, a survey was conducted prior to and again 3 weeks after. There were 10 questions assessing room cleanliness and readiness on a 1 to 5 scale, with 1 being completely unacceptable and 5 being ideal. The initial survey results had an average total score of 3.23. The follow-up survey had a score of 4.1, which shows a great improvement in a short period of time. Again, it was 3 weeks. One OR nurse even asked that I conduct a final survey in a couple more months in order to see how much more they can improve with a little bit more time, since there's been such a big improvement already. After speaking with her, a final survey will be sent out around midsummer. As stated earlier, there are currently 2 new employees in the new orientation process. Current assessment and interviews show the new process to be welcoming and positive for new staff. Upon completion of orientation, a full assessment of independence and understanding will be done. We'll do this by observing their work and interviewing them regarding perception of the process. Just simply asking them, did it work? Collaboration within the leadership team will continue as a way to encourage compliance with the checklist peer review, holding the CFAs accountable for the work they do, and recognizing them when they do it well. The role of a leader is not to rule their employees, but to guide them. Management is considered a controlling aspect of leadership, but full leadership maximizes effectiveness and increases productivity. It was the goal of this project to work with the CFAs rather than control them or tell them what they're doing wrong. Their input was vital to the success of the project throughout the change process, from the new staff to the experienced ones. Newer CFAs had a lot of great input on the orientation process and what could be better. Experienced ones helped verify responsibilities and work on measures to become more organized in their duties. There were concerns brought to the foreground regarding changes and how the opinions of the nurses would affect their role, but the sails were adjusted to help make these changes positive. Transformational leadership is doing the right thing for the right reason, treating people with care and compassion, and encouraging and inspiring others. Working with the CFAs instead of against them in the planning and implementation phases allowed for a shared vision with them. Clarifying expectations and common values with the team was accomplished through working together, and this information was used to challenge the CFAs in their current processes and inspire them to want to do better. Collaboration with them and the leaders in the group helped meet the expectations of improved processes throughout the implementation. These improvements and taking ownership of their work empowered the CFAs. This results in long-term improvements and more positive communications between nurses, CFAs, and leadership. In conclusion, preventable healthcare-related infections result in 99,000 deaths per year. Surgical site infections are one component of that statistic that the CFAs do have some control over. Improving the cleaning process in the OR can help reduce the volume of SSIs in our facility. By working to improve the cleaning process through this project, the communication and accountability between the CFAs and nursing staff was also improved. By making a few changes, including re-education of staff, noted improvements have already been seen through the clean trace testing and survey results. Continued improvements are expected, as well as an increase in morale throughout the operating room over the next few months as a result of the quality improvements made here. One of the most important lessons learned through this process is, as a leader, in order to get the support of the staff, you must first gain their trust by working with them. Collaboration is key when implementing changes and process improvements. Do it with them, not to them, if you want to be successful. Lastly, people generally want to perform well and improve, but not at the sake of their personal pride.